So let's finish up this discussion by discussing the neurovascular structures of the pectoral region. So these are the nerves and the vessels. So the breast is not covered here because the breast is so special and demands its own attention, and we will discuss this somewhere else. Alright guys, catch you in a minute. So we are starting with the nerves and then we are going to vessels. So the first nerve is the lateral pectoral nerve. The lateral pectoral nerve. So this is a nerve from the lateral cord of the brachial plexus. So this is the lateral pectoral nerve. So it's coming from the lateral cord of the brachial plexus. And I want you to pay much attention that this is a pectoralis minor muscle. This nerve does not go through the pectoralis minor muscle. So it goes above the pectoralis minor muscle. And then it goes to supply the upper part of the pectoralis major muscle. So this nerve, the lateral pectoral nerve, this is actually the lateral pectoral nerve. This one, it does not go through the pectoralis minor. So it pierces the clavipectoral fascia. So this is the clavipectoral fascia to go to supply the pectoralis major muscle. So it has also another branch. It has got a branch that goes, it loops around to connect with the medial pectoral nerve. So this is the medial pectoral nerve, and this nerve, it has got a branch which is known as the ansa pectoralis. So the ansa pectoralis will connect. It's a branch from the lateral pectoral nerve that connects to the medial pectoral nerve. Guys, what is so important about this nerve is that it does not go through the pectoralis minor muscle. So it goes above the pectoralis minor. So this is the pectoralis minor, and this is the lateral pectoral nerve does not pierces. Okay, so what does it supply? Because it doesn't go through the pectoralis minor, so it doesn't give any branch. You can't see any branch that is going through the pectoralis minor. So this nerve will supply the pectoralis major muscle, but the superior part, the clavicular head of the pectoralis major muscle. So this is the main part of the main muscle that will be supplied by the lateral pectoral nerve. So the clavicular head and the superior part of the sternocostal head. And then we have the medial pectoral nerve, which is almost quite the opposite of the lateral pectoral nerve. So this nerve is coming from the medial. It is coming from the medial cord of the. So this is the medial cord of the brachial plexus. So it's coming from the medial cord. This is the medial pectoral nerve, and then this muscle now pierces. So it punches the pectoralis minor muscle, and then it supplies it, and then it goes to supply the lower part of the pectoralis major muscle. The lower part of the pectoralis major muscle. It's coming from the lateral cord, from the medial cord of the brachial plexus. It pierces through the pectoralis minor. It supplies the pectoralis minor, and then it has got some branches that are going deep to supply the lower part, the lower sternocostal part of the pectoralis major muscle. So from this picture, this is actually this is the medial cord of the brachial plexus, because it's medial to the axillary artery, as we said at the time. And then so it has got a branch here. This branch is known as the medial pectoral nerve. The medial pectoral nerve, it pierces the pectoralis minor muscle, it supplies it, and then it go to supply the pectoralis major muscle. So how many muscles are being supplied by the medial pectoral nerve? Okay, so we have the pectoralis minor muscle and the lower part, which is the sternocostal part of the pectoralis major muscle. So actually guys, I told you the other time we were discussing the pectoral region that the medial pectoral nerve, when you're going to do dissection, so you will find that the medial pectoral nerve is actually on the lateral side, and the lateral pectoral nerve is on the medial side. Don't be confused. It's okay. It's totally okay, because number one, the lateral pectoral is not the lateral pectoral nerve because it's coming from the lateral cord. It's not because it's found on the lateral side. Okay, it is called the lateral pectoral nerve because it's coming from the lateral cord of the brachial plexus, but on its course it goes to the medial side. It goes to the medial side. Quite the opposite to the medial pectoral nerve. It's coming from the medial cord of the brachial plexus, but it is situated on the lateral aspect when compared to the lateral pectoral nerve. So the medial pectoral nerve will be on the lateral side, and the lateral pectoral nerve will be on the medial side. How many muscles supplied by the medial pectoral nerve? two muscles, the pectoralis minor and the pectoralis major. So does it pierce the pectoralis minor muscle? Yes, it does. But the lateral pectoral nerve, it does not pierce the lateral pectoral nerve. And then we'll have a long nerve here. We called it the other time the long thoracic nerve. This one is the long thoracic nerve. So this actually is coming from the the ventral rami of so it's formed from the roots, from the roots of the brachial plexus. How many roots are combined? So the ventral rami of spinal nerve C5, C6, and C7. So C5, 6, and 7, they combined from a nerve. This nerve is very long. I told you it's about 22 to 24 centimeters. And so it it is the nerve of thoracic region. So it travels lateral on the lateral side, superior to just superficial to the serratus anterior muscle. So it supplies the serratus anterior muscle. So it supplies the serratus anterior muscle. So this nerve is actually found on the axilla, and I told you the other time discussion of the axillary lymph nodes. So sometimes when they are doing the dissection of the axillary lymph nodes can be injured, and the injury of this muscle, injury of this nerve, will result into paralysis of the pectoralis of the serratus anterior muscle, and so the result will be the winging of the scapula, the winged scapula. This is the 1000th time we're talking about the winging of the scapula. All right, guys. So let's go to another nerve, which is known as the intercostal brachial nerve. The intercostal brachial nerve. So this nerve is coming from this intercostal nerve. So intercostal, intercostal. Costal means rib. So it's found between two ribs. So actually, you see how we form these intercostal nerves sometimes later, but for today, you know that the intercostal brachial nerve, it is a branch of the second intercostal nerve. It's a branch of the second intercostal nerve. So it's coming from the intercostal space to the brachium. So intercostal brachial is coming from intercostal spaces to the brachium. Okay, so it will combine. It will actually join the medial. This one is the medial cutaneous nerve of the arm. The medial cutaneous nerve of the arm. So it will be joined by the intercostal brachial nerve to supply the medial part of the upper part of the arm. So this is the I don't know what color it is. I don't know. This brownish, I think brownish. So this brownish color here is where the intercostal brachial nerve will supply. So this one and this one. So the skin of the upper rim just on the medial aspect. Guys, I told you also when I discussing the axilla, I told you this nerve can also be injured. The most common nerves to be injured during the axillary lymph node dissection. You see where it is? It's coming from the chest. It's coming from the chest to the arm. So it's like it's prone. So it's prone to injury. So when it's damaged, someone will lose sensation on the medial aspect of the arm. So the patient will present with numbness of the arm on the medial side. And then we'll have the intercostal nerves. So the intercostal nerves, they're actually also the cutaneous nerve. They give the skin sensation. So they are not the motor ones. To this part, they're not the motor ones. So we have the intercostal nerves. We have the anterior branches. So these are the anterior branches of the intercostal nerve. And then we have the lateral branches of the intercostal nerve. So together these nerves will supply the skin of the pectoral region, the skin of the pectoral region. But someone is wondering, what is this? What are these intercostal and why are they called intercostal? Let me show you how we get this anterior and lateral cutaneous nerve from the intercostal nerves. So we have the intercostal nerves. Actually, the intercostal nerves, they are just spinal nerves, but they are coming from the intercostal spaces. These are the nerves that are coming from the chest part, the thoracic part of the spinal cord. Okay, so the spinal cord has got different parts. So the nerves that are coming from the thoracic part, they are known as, they are forming intercostal nerves. And then this is the intercostal, this is the spinal nerve, so the intercostal nerve is called intercostal because it is emerging, like traveling through the intercostal spaces, so spaces between two ribs. Alright, so this nerve, as it goes, you see somewhere here, it will divide itself into the lateral branch, and then a part of it continues at the anterior cutaneous branch. So we have two branches from the intercostal nerve. The lateral cutaneous branch So this is what you're seeing, because supply the skin on the lateral side, and then we'll have the anterior. So this one, they go in this way to wind up to form the anterior branches. So they are anterior intercostal anterior cutaneous nerve. They are branches of the intercostal nerve. So we discussed about this intercostal nerve. This was just a summary, but we discussed about the intercostal nerve sometime later when we are doing the discussion of the thoracic or the thorax. All right, guys. Let's now dive into arteries. Let's switch to arteries. So the arteries of the thoraco of the pectoral region, the arteries of the thoraco the pectoral region. So the very first branch is the thoracoacromial artery. So this is the thoracoacromial artery, guys. If you remember, the thoracoacromial artery was coming from the second part of the of the axillary artery. So the axillary artery has got 3 parts. The second part has got 2 branches. The first branch was the thoracoacromial artery. So the thoracoacromial artery, it has got 4 branches, if you guys remember. So the first branch was the pectoral branch, and the pectoral branch is the biggest branch that supplies the muscles of the anterior muscles of the pectoral region. So it supplies almost all the muscles, the pectoralis minor, pectoralis major, and some other muscles. And then it supplies also the breast. So the breast will also be supplied by the pectoral branch of the thoracoacromial artery. But you see, the thoracoacromial artery has got another branch here, which is not the clavicular branch. So the clavicular branch, you see, it supplies the subclavius muscle. The subclavius will be supplied, but we'll add another branch, which is the deltoid branch. We'll have the acromion branch here, but we'll have the deltoid branch. The deltoid branch is learning together with the cephalic vein within the deltopectoral groove. We saw the deltopectoral groove the other time discussing the pectoral region. Okay, so this is the very first branch that supplies the costal the pectoral region. So the thoracoacromial artery through its branches, the major one, the pectoral branch, and then the second branch. The second artery is that is supplying the pectoral region. It is the lateral thoracic artery. So we have the lateral thoracic artery. The lateral thoracic artery would normally come from the second part of the axillary artery. So the second part of the axillary artery has got 2 branches. The first one was the thoracoacromial artery. The second was the lateral thoracic artery. So mainly this branch is coming here, but it sometimes can come from some anatomical variation in which the lateral thoracic artery may come from the thoracoacromial artery, or sometimes from the subscapular artery. Okay, so in most of the time you find it coming from the second part of the brachial or the axillary artery. So this one is the major supply of the lateral side of the it's not the lateral thoracic. It's lateral thoracic. So it supplies most of the lateral region here, So as you see, it descends above the superficial to the serratus anterior, same as the long thoracic nerve. And then it supplies the serratus anterior, the pectoralis minor, but the lateral part of the breast. We're going to see the discussion of the breast. You see, one among the most important nerve vessels that supplies the breast will be the lateral thoracic vein. So it travels on the edge of the pectoralis minor, on the edge of the pectoralis minor muscle. So this is the second artery that is supplying the pectoral region. And then we have another one, the internal mammary artery. So the internal mammary artery is also known as the internal thoracic artery. Should we know the cause of the internal mammary artery? No, I wouldn't recommend to know the cause at this point, because we will have our time to talk about the internal mammary artery sometimes later. We are going to discuss the internal mammary artery when we're talking about the anterior chest wall. The anterior chest wall we're going to see in details. So should we also discuss about the branches? No, not at this point. Not pericostal momento, not at this time, not at this moment. Okay, so these are the branches from the internal mammary. So they are perforating branches from the internal mammary artery. We're going to discuss internal mammary artery sometimes later, but it supplies the pectoralis major on this side, on the medial side, gives some part of the, the medial part of the breast, as well as the skin, the underlying skin. All right, so the posterior intercostal arteries, they are almost the same. Something that I haven't mentioned. So from the internal mammary artery, we get the anterior intercostal arteries. So these are the branches. These are the branches from the anterior intercostal, and then from the posterior intercostal vessels, they are coming from the the thoracic aorta. So we have the thoracic aorta or the descending aorta, which is giving some branches going through the intercostal spaces, and we call them the posterior intercostal arteries. And then the posterior intercostal arteries will give some branches that you come to supply the lateral part of the breast, the lateral part of the pectoral region and the breast. So we also discuss about these vessels, some of the cause and the origin of these vessels sometimes later. So guys, this is it on the discussion on the vessels, the nerves and the vessels of the pectoral region. So I told you that the time, I tell you every day that subscribing is a good way of keeping keeping videos coming to you, suggested to you. I'll be even releasing videos, so for you to be able to be notified when we release a new video, you need to subscribe. And so this is it. Next is a discussion on the breast, so don't miss the next part.